It's Dr. Thomas Burnett here at Regeneration Pittsburgh. I'm talking with Ariana. Hi, Ariana. Thanks for offering to tell your story here. Let me say, about 2.5 years ago, you came to me with left knee pain and diagnosed with left meniscal tear. And the options were surgery, correct?
Correct.
And it really wasn't the best option for you at the time, so we decided to go with the bone marrow aspiration.
Right.
And it's been over 2 years ago. Can you give us an update? How much change or how much improvement have you seen?
It's amazing. It's the best thing I've ever done. I would do it again if I had to. I am lifting now, I'm running now, better than before the tear. At one point they told me I would probably never be able to lift again or run. So I'm completely amazed. I mean, I literally am doing things today that I couldn't have done 2 years ago, and I'm doing them all better.
That's fantastic. And you're very active in CrossFit and everything.
I do CrossFit, I do my squats, I do lunges, I do spinning, I do running. And I'm telling you, I've recommended this to so many people because to think I lived with that pain for almost a year, and now I'm brand new. Well,
it's great to hear that. Yeah. Second question, would you recommend this, and I know you have already, to somebody with a similar presentation?
Absolutely. Yeah. Yes, over and over I would.
Well, thank you very much again.
Thank you.